let's start with your background. So I know that you ended up getting, you are a doctor, so you've studied quite a bit to become an audiologist. And was your studies all in New York, or what school did you go to, or your training?
Yeah, so to become an audiologist in the United States, first is a bachelor degree, an undergraduate degree, and then a 4-year course of study for a doctorate in audiology called the AUD, Doctorate in Audiology. So it's important to differentiate. It's not a medical degree, not medical school, but it is an intensive 4-year study. The first 3 years are coursework and supervised clinical work, and then the last year is a residency, full-time, 12 months in different facilities for doing practical work.
It's not a medical degree per se, but it's very similar. It's more like a medical type degree than, say, like a PhD, right? Because you did like clinic hours and you did like externship, internship, that sort of thing. It's very similar.
Correct. Yeah, it's called a clinical doctorate,
Okay.
as opposed to a PhD, which is a research doctorate. But there was also elements of research within the program.
Okay.
Mm-hmm.
And where are you located right now? Where are you based out of?
Right now, I live in Haifa, Israel. I just moved here a few months ago, but up until then, I did all my studies and my work experience in New York.
That's awesome. I didn't realize you're in Israel right now. So what time? What time is it there? I think I did my estimations based on on Eastern time. I guess you are definitely not Eastern time.
Yeah. No, I'm at 8:30 p.m.
Oh wow. Okay.
Mm-hmm.
Well, thank you for making this work.
My pleasure.
Let's see where to start. I learned a new word today, and getting ready for this podcast. It is presbycusis.
Very good.
And it was I spelled it wrong when I heard it first, but from what I understand, it's something that happens to everybody, or a large percentage of people as we age. It's the hearing loss that happens over time.
Excellent. Hearing loss associated with aging is called presbycusis, and that differentiates from hearing loss caused by other things. Like someone could have, little kids get ear infections, and that could cause a hearing loss. Or someone could have a car accident or some kind of head trauma, and that could cause a hearing loss. Or they can get sick with meningitis, which will affect their cochlea. So there's lots of different ways that someone could get hearing loss, and also children can be born with hearing loss to begin with. But then one of the most common ways is just that over time, along with the general process of aging and wear and tear and degradation of different systems in the body, presbycusis is that process in the cochlea and of the eighth nerve, the auditory nerve that goes from the ear to the brain.
And does that happen to everybody? Is there percentages, or?
When you look at it from population studies, so if people are in their 50s to 60s, then it's about 8% of the population. And then you go from 60s to 70s, and it goes to 25%. And once you're at around 70s and 80s higher up, then it's about 75% of the population. So most people as they age will have some degree of hearing loss. And then the older you are, the more likely it is.
Okay. No, that makes a lot of sense.
Yeah. And also, I'll just add about that, presbycusis is characteristically a high frequency hearing loss. So that means that most of the time it will be a high frequency hearing loss first and then progress into hearing loss across the board. And what that means is that it starts with difficulty understanding speech, because high frequency information is all those sounds that is telling you the S sound and F. So those are very similar, and they're high frequency. S like snake, or F like Frank, are two very similar. And so it starts with clarity. It's always, I can hear you, but I'm not quite sure what you're saying. And that's like kind of the beginning, typically what happens.
So it's certain words, it's certain sounds, but also, I mean, is there some truth to the fact that my dad ignores my mom all the time? I mean, is it harder to hear female voices, child voices over like deeper voices?
Well, it is true that women and children have higher frequency voices overall. So that is true. But in terms of spouses not hearing each other, that goes both ways. Yeah.
Well, based on the high pitch, I think there might be something to the man not hearing the woman more than the woman not hearing the man. Maybe.
Yes,
We need
absolutely.
to do a study, I think. That'd be scientific research right there.
Yeah.
And one thing I wanted to point out is that I have I've throughout my life I've had pretty good hearing, and coupled with ADD, it's a pain because at night I don't sleep well, and so I sleep with earplugs in, which I'm sure can cause problems, but it helps me not hear the ambient noise or distractions throughout the night. And then at work, I have a hard time tuning people out if they start talking like cubes away. I can't like tune it out, so I always have earbuds in my ear. So it's hard for me to imagine like, oh man, did he just turn it off, like turn down the sound on it, on hearing it? That'd be kind of nice for me. But I know when I get there, I'm not going to be grateful for it. But that's kind of where I'm coming from.
That's very interesting. Yeah, there's a lot to talk about processing. And it's one of the things I talk about a lot on my podcast, which is that we hear with our brains, really. We can, our ears are the organs that are taking in the sounds, but what the brain is doing is organizing the sounds, like you're saying, tuning things out, focusing on what you want to hear. So what's happening with the brain and the cognitive function is hugely important in being able to process speech. So people with an accent, it's harder to understand them. Like, why is that? Because you're talking about the overlays, the context, the language. Someone familiar is easier to hear than someone who you never spoke to before.
Mm-hmm.
So there's all these other factors that go into it. We talk a lot with children, how they're in a classroom and there's like 18 things going on in that class and they're supposed to just pay attention to the teacher. Like, that's a challenging situation. So when you're talking about someone who is in their later years and everything is just a little bit slower and takes more time, processing speed, cognitive processing speed is also a little bit slower. And so that's one element which, whether or not they have a hearing loss, whether or not they have a hearing aid, that's an independent factor of paying attention and being able to listen to words and understand what someone is saying. So we have to take all that into account.
Well, I imagine you have with seniors, you have just the body's aging process where things slow down. The ear, the organ of the ear doesn't transfer the sounds to the brain as clearly as it did before. But then for most people, I would assume they're going to have some damage throughout their lives, right? They've been exposed to loud noise, whether they went to concerts or construction equipment like machinery. All these things can add to that aging effect. So depending on maybe their occupation or whether or not they put headphones or earphones on while they were mowing the lawn, things like that, that's going to accelerate that deterioration of the hearing over time.
100% true. Yeah. So then it could be compounding factors. And I think this one of the big things that we really advocate for as audiologists is that everyone should get their hearing tested wherever they are in their lifespan. And lots of times the adult children of the elderly, so people in their 40s and 50s, right, middle-aged children, are bringing their elderly parents, and they themselves should actually be getting their hearing tested as well, because that's, if you can catch it when it's just starting out and treat it right away, then that can have better outcomes as that person ages, because they're already giving input to their brains throughout those years that they're still working, when they're younger and middle age. And if they're already associated with an audiologist, they know what's going on. It's a totally different process than someone who comes in when they're 70, when they really should have been wearing hearing aids for the last 20 years when they were 50. But yeah, when we see people that come in when they're older, the elderly, then you have a whole nother set of problems. Maybe I shouldn't say problems, factors, issues, considerations that, is their manual dexterity. How are they going to handle a small piece of equipment? Like, can they do up their own buttons is one of the questions we ask, because we want to know how are their fingers
The fine motor
being
skills.
Yep, open and close the battery door to change the battery and put it in their ear and stuff like that. Whereas if they're already familiar with it from using it for years, then that's not an issue. Also vision, being able to see the little marking, is it the right or the left ear? So, okay, so we have ways to get around it. We make the dot way bigger, or we put a tactile clue instead. But, there's a lot of different considerations that we have to look at, on top of cognitive function and, even interest or motivation. Because many times we know that people, as they get older, maybe they're already just, it's okay, like you said, I'll turn it off. I don't need to hear everything. I'm
Hmm.
already irrelevant, and social isolation is a big problem
Yeah.
with the elderly. And we know that there's an association between untreated hearing loss and social isolation and depression. Um, I'll caution that statement too, with not a correlation. Okay, we're gonna say not one causes the other, but definitely that there is a known association. They go together.
Well, that was good. So I have a couple follow-ups on that. Um, is there, you mentioned at first the getting your hearing tested. Apart from like known situations where you can take preventative measures to protect your ears during loud events or in environments where there's a lot of noise, are there other things that people can do to prevent deterioration of their hearing over time?
Unfortunately, no.
Okay.
That is, the one word answer. But knowing the hearing loss, like having your hearing loss tested, even to have a baseline when you're 50 years old, just kind of a rough cutoff, like, get your hearing tested when you turn 50 at least. So then you have a baseline, and then you come back when you're 55 and you see if anything has changed. So then you kind of have an idea, a little bit of a projection of what's going to come. If in those 5 years or 10, between 50 and 60, what's going to happen between 60 and 70.
I see.
Not always like a perfect curve, but there are people, that 25% of people in their 80s actually might not have any hearing loss. That's, if it's the majority, then there are those people in the minority who don't have the problem.
Right.
But yeah, I think that just awareness of audiology as part of preventative measure, like you go to the dentist every year, you get
Right.
your eyes checked every year. Once you're getting to middle age, it's a good idea to get your ears checked.
You also mentioned the dexterity, right? And for in my mind, the hearing aids have gotten so small you can barely see them anymore. The more modern ones, but when you're looking to fit, say, a senior, um, perhaps maybe the most stealthy small device isn't the best for them because they may not be able to operate, the button switches, batteries, as you mentioned before. Is that something that would be a consideration when fitting a senior with a hearing aid?
Absolutely. We definitely take that into account. And there's lots of different styles of what it can look like. Sometimes you see those pieces that they kind of look like a cashew or
Yeah.
some kind of
Hmm.
like, thing that fits into the ear's bowl, like the
Yeah.
whole inside
Uh,
ear. And those are very popular because it's just one piece. It's the whole thing. It fits in snugly, and that's it. And those can be made in different sizes to have a bigger battery, to have an easier to open door. So that's a very popular style. And the computer that's inside, like the microphone and all the different programmed circuitry, is the same, whatever the style is. So that's purely style and, like you're saying, manual dexterity considerations. So the second class of style is the kind that goes behind the ear.
mhm.
There's like an extra piece in the back and then a tube that goes in the inside. And that also is sometimes necessary because those can be a little bit more powerful if the hearing loss is more severe. And yeah, you definitely have to take into account if they're able to manipulate, put in all those pieces, or to make sure that whoever comes with them to the appointment, their child that they live with or their health aide or whoever is with them, that they can do it for them. And if that's a solution, then that person needs to be trained on it and come to the appointments. And or we also sometimes take a video during the appointment to show exactly how it should be put in, and then have that video sent out to the whole team.
That's a good idea. It's a really good idea. With regard to hearing aids, is the main purpose of the device to amplify the sound?
Yes, and yes, and so there's not easy answers, right? Hearing aids are meant to amplify the sound, but the whole amazing and wonderful thing about a hearing aid is that, and the hearing aids these days, digital hearing aids that are programmable, is that they are programmed, tailor-made, and specific to each patient, to their hearing loss. specific to what frequencies they need amplified, what kind of noise reduction settings they need. So there's all this additional programming that goes on, and all these extra features that are built, and thousands of dollars of research going into each device. That's why they're so expensive, because you're paying for the research of the circuitry of the programming to do all this noise canceling, to focus on speech, and make it both comfortable but clarity. So when there are these cheaper knockoff kind of devices that are like 1/20th the price of an actual hearing aid, and that you can pick up off the internet or at a pharmacy or something,
The
called an amplifier.
the
Yeah,
infomercials late at night.
exactly, amplifier. And it's like, yes, it can be an amplifier, but it's not a hearing aid, and it's not going to give the benefit of a hearing aid. It's actually probably causing more discomfort and possibly damage. And a lot of people get hooked into those because the price is right and it looks like a good solution. The marketing is always there. So it's extremely, extremely important to see a licensed and qualified and competent audiologist who is trained and has good reviews from your friends and family. You don't just go to any person that puts up a sign that we sell hearing aids. There are also hearing aid technicians or specialists who are not audiologists, but are trained in hearing aids. And that's where you kind of have a gray area, that if the person is well versed and researches and trains themselves, and there are excellent hearing aid technicians and specialists, but you also would prefer to have someone who has 4 years of training and medical liaisoning, and they're coming at it from a medical perspective, and not necessarily from a commercialistic perspective. And
right.
Again, unfortunately, you also have audiologists who do have the training and the credentials, yet unfortunately they do see their practice more as a business than as a medical practice. So really is a case by case, but hopefully as a general overview of the profession, audiologists have the credentials and the training.
Well, like you said, check for reviews, find people that you trust, would recommend, and go from there. And in the research, I found out that you are a licensed hearing aid distributor in New York.
Dispenser, yes.
Dispenser? Oh, see,
yes.
That sounds like a drug then, like a drug dispenser. So is that, are hearing aids, are licenses required in all 50 states for dispensing those?
I would guess so.
You would guess so. Well, New York's heavy on the licensing and whatnot, so I didn't know if that was a New York thing. I have no idea.
There's definitely some sort of process or procedure, because you can't just open a business. There must be something in every state.
Okay.
I think. Yeah.
Let's say, totally hypothetical, I have a father who's about to turn 70, and I noticed that he has some hearing loss, where he's not hearing as well as he has in the past. And you talked about making sure that they visit an audiologist. As far as in the United States, at least, when someone or their spouse, for instance, notices that they're not listening as well, and they suspect a hearing problem, would the first step be to the primary care doctor, or would it be to, if they need a referral, I guess, to an ENT, an ear, nose, throat doctor, and then they would send it out to the audiologist? Or how does that process work?
So really the answer is any professional of the ones you mentioned, a doctor or an ENT specialist or an audiologist could be first, and any of the others will be next as needed.
Okay.
And sometimes it just depends on the insurance process,
Yeah.
if they need to see their primary care physician for the referral or not. But if they get a hearing test and then the hearing test says, well, you need medical clearance, then they'll see their doctor. If they see the doctor will do some in office quick, kind of a questionnaire more. Are you having issues? Do you want to see an audiologist, get a hearing test? Then they'll refer them over to audiology. It can start anywhere, but probably throughout the process, they'll see at least their doctor and an audiologist, and if needed, an ENT specialist.
I imagine that audiology and hearing aids are nothing new to Medicare. insurance plans. I'd imagine that's something that's covered, right? Because people, you said 75% or so, people when they get to 70, 80 years old are going to need that. So is that something that's typically easily covered? There's not much difficulty getting that approved?
Actually, it's much more complicated than that.
It always
Much,
is.
yeah, there seems to be a very big controversy and turf war, you might say, in the last few years about calling hearing aids not a medical grade device, but a consumer electronic device. And this big fight and this big lobbying has taken everybody a little bit time to like catch up with what is this a medical thing that needs to be covered by medical insurance and Medicaid, Medicare, or are we gonna just not do that? So I think it's state by state right now. I'm not well versed on the laws, but I know that Medicare is covering some portion, or at least kind of one kind of device, but not really the higher end devices. This is something you need to talk to the specific audiologist with, but it's not so easy. And unfortunately, there is going to be an out-of-pocket expense. And like we said before, if you're seeing someone who's providing you with the service, then often what happens with hearing aids is that you're paying an upfront fee for the device, but really bundled in that price is all the servicing, programming, up to 2-3 years that's going to have to come with that, of coming back and getting it tuned again and coming back 6 months later to have it reprogrammed, because as you wear it more, your ears adjust to it, and then you need a little bit differences. These devices break, they get lost, there's things that need to happen, and all the service warranties, loss and damage warranties are all included in that price, plus the service and expertise of the person fitting the device is all included. So that is changing as well within audiology, where some audiologists are unbundling the pricing so that you can see what you're paying for the processing, fitting, for all the different items, itemizing their service as opposed to one fee. But they are very expensive, and that's prohibitive for some people. So Medicare is an option, but not always.
Are hearing aids designed, and I guess they're probably all going to be different, but in general, are they meant to be taken out at night?
Yes.
Okay. So they're...
Yes, we say that hearing aids are to be worn during all waking hours, and you don't want to get them wet. So not in the shower.
Are they a set it and forget it type thing? Like, do you put them in and then adjust it? Or typically once you adjust it so that it works and everything sounds good, then you just basically take them in, take them out, set them on the counter kind of thing?
So there are the kinds where, like you're saying, you just put them in and don't worry about it, and it's all automatic. Those tend to be a little bit more expensive when you have them adjust automatically to different situations. And some people, and then the lower end, or you can have it programmed where it goes, when you press a button, it goes through different environment programs. So you have a quiet setting, and then you have like a restaurant setting, or you can have one programmed setting that's like if you're in a big cavernous reverberant room, which tends to be like a place of worship. So that could be a setting for that. And there's always a volume control that you can have for louder and softer. And it really depends on who the patient is and what their life is like. Some people want to be able to control it and feel more comfortable that they can have it louder or softer as they want. And other people don't want to have to deal with it, or they can't deal with it. And, you have someone who you just want to have it there and not have any buttons that can be messed with. So that can be programmed.
It sounds like hearing aids are a little bit more interactive. And as far as like as a device, I'm thinking like when a senior gets to the point where they can no longer take care of their activities of daily living, and they either need care or they are in whether a skilled nursing facility, assisted living, or something like that. Do a lot of those people have devices? Because it sounds like if they're unable to care for a lot of things, I'm guessing that they don't, right? If they're not able to like adjust and respond back, because it sounds like it's a little more involved than that.
So I would say it depends on their condition and the level of care that they have available to them. If there if there is someone who can put it on in the morning and take it off at night and keep track of the batteries and all that, just as they would help them get out of bed and in the morning and put them back into bed at night, then that would be of great benefit to their quality of life in those years. I would argue that even more so, it's important that they should have that ability of accessing sounds around them. It depends on if it's available. If the care is available, can't rule that out. And I'd add that also their experience and reliance on a hearing aid would come into play. So if they've never had a hearing aid and now they're 97, I don't think that's the time to introduce the hearing aid, because that would be a detriment to their, like, what's all this new stuff that
Right.
that what are you playing with my ears for? But if it's someone who's been wearing a hearing aid, experienced user, relies on them, depends on them, enjoys using them, it helps them, it benefits them, then of course it should be included. And
Right.
it's very painful when we hear that, oh, this person was in the hospital for 3 weeks for something, for some medical thing, and the hearing aids were off the whole time they were there.
Yeah.
Specifically at the time when they need to hear their doctors and they need to interact with people and they're already in, a vulnerable state, and now the thing that they used in their life is being denied them. So case by case.
Yeah. So if they've had it, right, say they start wearing it at 70 or 75 or whatever it is, to the extent that it is possible, let them continue to experience that and have that with them.
Absolutely.
Have you ever seen like old timey videos or movies? And I think there was even one on one of the new Hobbit videos that one of the dwarfs had a little horn they stuck to his ear and came out like that. Did those work?
So what our ears do, the actual ears that we have,
Yeah.
So it's shaped in a little funnel. Like, the reason it's shaped like that, it's shaped like that, and then it gives us a lot of cues from the environment. So, like, for example, from the front, we're catching more sounds from the front than from the back because it's sticking out. All these curves are like helping the sounds go in. So there is something to the fact that we have ears. They help us funnel sounds in from the environment. And we know that different animals have, different big ears that do different things acoustically. So yeah, it does help when you cup your hand on your ear. That actually makes a difference. You can hear that. So yes, when there was that technology level available, it made a difference.
Do they still sell those?
But no, we do not sell those. And
is that like when you show the range of options from inexpensive to expensive? The first one is a funnel.
Listen, a lot of people, the first 5 to 7, 10 years that they know they have a problem, they do the hand.
I've done that. Yeah, it works. Yeah.
Right? It works for when you need, and you're at a cocktail party, a graduation, whatever, then that's a quick go-to. But that's not doing what the hearing aid is doing, which is bringing all the sounds that are outside of your range of hearing into your range of hearing, specifically set to your hearing loss. And that's an invaluable technology. Right. Yeah.
But the ear or the hand to the ear is equivalent to squinting when you need glasses, right? It's just like the first steps. Like, it helps a little bit, but you probably need something.
Yeah, and there's stats about that when people notice they have a problem to when they get help and when they go to an audiologist is an average of 7 years.
Oh, 7 years?
Yeah. And so you're talking on, like, let's say middle age. Let's go from like between 40 to 60. That's usually like the years when something is starting to the brewing of some hearing problem. And that's, people are still working, they have children and grandchildren maybe, or like people in their active lives. Like nowadays with all the great advances, 40 to 60 isn't old. That's
right.
That's you're totally still in your life. You've got your smartphone, technology, and that's the time when you have so much to gain from going to see what's out there for you, so that you could prepare for when you get older.
Well, I would say that the earlier, it's a big investment either way, right? But the earlier you get it, the better the ROI to you, because or to the individual, right? Because your mental capacities, your physical capacities, like all these things are better, stronger, and are less degenerated as we age. You know, our everything kind of slows down. And the earlier I would think that we get hearing aids, we're getting more value out of that investment the earlier we get them. If we wait till later in life, you know, I think it's less helpful than if we would have got it earlier.
That's exactly right. And there's research to back that up, which is about language. Yes, language deprivation and sound deprivation. So the umbrella term is auditory deprivation. So if you're going many years where no sounds are coming in, those parts of the brain kind of say, okay, nobody needs me. So they start to atrophy and are deprived of sound processing and aren't being used. And we know that if we're not using something, then the neuroplasticity, the way our brain works, is that the resources go somewhere else where you are using it. So then if there's been all these years when there's been an auditory deprivation and then you put on a hearing aid, then it's like you have to retrain all those pathways and it's a big cognitive load. Whereas if you find the problem and treat it right away and don't wait 7 to 25 years, then you won't have a deprivation issue. You'll be able to nip that in the bud.
It keeps you sharp as a tack.
It won't be able to relieve the problem, but it's at least not letting it get worse.
Yeah, and you had mentioned neuroplasticity in the messages that we had exchanged. I didn't know how that would tie, but you just did it perfectly there, and I didn't even have to ask about it. And this is a little left field, but since you mentioned that our ears help channel the sound into our inner ear, anyway, it helps channel the sound, right? So we can hear. Does
podcast episode on that, so you can go.
What episode is that? I could refer back to that so people can really learn the technical terms.
It's episode 3.
3, okay.
All about hearing, I think. Yeah.
All about hearing, and all of I did listen to that one. Like I said, there were a lot of terms that I don't remember. I'm not good at anatomy, that's why I'm not a doctor. But I did enjoy your podcast. You have a lot of good information in there, a lot of good episodes, and appreciate you putting that out there. About people's ears.
Mm-hmm.
If they have a function, they channel sound into the ear for us to hear. Do the things that people do to their ears nowadays, does that affect that at all, between like multiple earrings and the gauges that are like huge and all this stuff? Does that affect it at all?
Are you talking about this one viral picture that's going around?
I haven't seen it, but I'm just curious because people, not everybody, but like it used to be a thing where people would put like multiple earrings in their ears, and now gauges are like all a thing where they're going to stretch out their earlobes to make them, huge. Does that affect the function of the ear? It's changing the shape of it. I imagine that's going to affect the functioning of it too.
Yes. Okay. So the funneling in is mostly with the bowl part, like the place where you could put your finger into.
Okay.
But that's not your ear, it's on the ear. Okay, so that's called the concha, and that's like the place
like
that's really, like a shell, exactly, is bringing in the sounds. And so the earlobe itself is not doing much in terms of that, in terms of this function.
So mutilate away.
And neither is like the outside, that's the helix and the outer helix. So I would say like piercings and gauges, not significantly affecting in any way. However, if you know about this picture that I'm talking about, it's a little bit disturbing. But this person did like a body modification surgery electively to basically make a hole through their whole concha ear, and it's like very large and very apparent and a little bit disturbing that they did it as an aesthetic bod mod. And that's been making the rounds. I'm sorry if that's totally, like you said,
no, I've got to find this now. I'm gonna have to.
But that absolutely affects 100% would affect their hearing, and not only their hearing, their localization.
So they went.
Yeah.
They went through like the inner ear, like not the inner ear, but that part. They did something. They put a hole like way back here.
Yeah, like a big hole, like the size of a penny.
They just took all that. They took it all. That's crazy.
Yeah, and the the person who like posted it is like the artist who might. I guess they consider themselves an artist.
Who took
Um,
this? That's not a piercing. That's like a surgery, right? They're just removing.
yeah, yes, it had stitches all the way around. Like, look at this amazing thing that I've
Oh my
done.
gosh.
Like, okay. So no judgment to someone who wants that and thinks that is aesthetically pleasing, but it is going to affect their hearing, and it's also going to affect their localization, which is that we know where sounds are coming from in the environment, to the right, to the left, in front or back. And when we have our ears facing this way, and also because we have two ears, so they're comparing, like the brain is comparing the input from one ear to the input to the other ear, and then we can have like a spatial map of where someone is calling us from, where those sirens are coming from. So that's going to affect that. Yeah.
Wow, that's interesting. Okay, I have to see this. I'll have to go find this when we're done.
Yeah. If you'd like to bring that back to senior care, that's one of the things. Like hearing loss is not a yes, no, all or nothing kind of diagnosis. Like what I talk about on the podcast a lot also is that there's different kinds of hearing loss, there's different degrees of hearing loss, there's different causes. So one person's hearing loss is very unique to them. It's very different than someone else's hearing loss. It can be the kind where they just need things louder and then their clarity is great. Or it can be even when they have the most expensive and powerful hearing aid, that person's auditory processing function. So what's going on when the sounds reach the brain, that's actually where their issue is. So it's not a hearing aid solvable issue. So we never can compare like, oh, I know one person, they hated their hearing aids, they never wear them, they spent all this money and they're in the drawer. Like that is what happened to that person in their case. And all the factors surrounding that, like did they want them? Were they motivated for them? How old were they when they got them? What support did they have? Did they like their audiologist and go back for the fitting appointments? Like
Hmm.
all of that goes into it. And so then someone else says, well, I shouldn't try because they had a bad experience. Well, I don't think you should base your what you do for you or for your parent, for your loved one, based on other people's stories.
Based
So
on one anecdotal experience. It's funny how not just in hearing aids, but in so many things in life, one person's like bad review or experience is going to weigh so heavily on us when, you know, there, if we were actually to do it, you know, there's a difference of us versus them, the doctors, like everything, the audiology, everything involved could be totally different. But, you know, well, if they had a bad experience, so hearing aids are not good. Yeah.
yeah, and their medical overall, their medical picture. Some people are looking at 7 other medical complications, surgeries, hospitalizations, and hearing is maybe lower on that list.
Hmm.
So for some people it can be a big priority, and they really, communication is like who they are. They need to be talking all the time. Those people that are telling stories
Hmm.
and want to be around everybody, they're always in the action. Like, they have a bigger motivation just from their personality to pursue that kind of treatment.
Well, and then earlier you'd mentioned social isolation, and I think some people, they don't mind. In fact, they may prefer to be left alone and kind of, they are socially isolated, but you know, if they don't want to be involved and they don't really care about their hearing, I mean, there's only so much you can do. Like you said, with differing priorities, it's hard to get someone to want to, you know, engage and get help for their hearing if they don't really care.
So I would argue chicken or the egg, because which came first, that they were left out of conversation, and it happened so many times they're like, you know what, it's not even worth my effort, and so then they became more withdrawn. Or were they originally just over it, and then they didn't care? You know what I mean? It can
Hmm.
go, it's kind of a cycle that happens over decades. um
That's an interesting point. I noticed that, like, when I'm at a say a conference or a speech or something that is maybe more little over my head, whether it's some a topic or terms I'm not as familiar with, or especially like learning a new language, it takes so much focus and so much energy to try and pay attention. And you know, I often go to sleep just because it's just so much. Versus in everyday English, it's pretty easy for me. But I imagine, and correct me if I'm wrong, but if someone who has these hearing problems and they're straining to hear F and S and T, and they're hearing, but they're really having to like focus, and it's wearing them out because they're putting so much energy into listening. I imagine at some point they're just going to give up because it is taxing on your body.
yeah, you really hit the nail on the head. That's one of the big kind of invisible factors you can't really quantify so well in the research, but it's always there in the footnote, like, you know, fatigue and strain and exhaustion and cognitive load, you know, like what's going on, how hard is this for your brain to focus on this. I think that's a big factor. Yeah.
Is there was there any other experiences that you had with your time at the VA or with the clinic work that you did with geriatrics that you do you think may be helpful or useful to know about, to share?
Yes, I have a few tips. Okay, so one of the important things is that an elderly person should never come to an appointment alone. And even if they're able to, even if that's something that they pride themselves on and there's still, you know, activities of daily living, like you said, that they're able to get to an appointment, take a taxi, etc. This is the kind of appointment at an audiologist, even for the hearing test, that it's important that someone else goes with them, someone who can keep track of the recommendations and even just be there, because it's often a longer appointment. The hearing test can take 20 minutes or so, plus or minus. So it's not the kind of in and out thing. There's going to be counseling, questionnaires and history taking before, and then counseling afterwards. So it tends to be a longer appointment than a typical appointment at the doctor or something. So number one, people don't really expect to spend so much time out, and then, you know, the day gets long. Sometimes people get tired, or they didn't realize they're going to be out that long, and they need certain food or medication or things like that they just don't factor in. So if you're thinking about an audiology appointment, definitely have someone accompany an older person. And then for sure, someone should accompany them to appointments that are related to fitting of a hearing aid, learning how to use it, how to put it on, take it in, take it out, how to change the battery, because it's just a lot of things to remember. I mean, even think about when you buy a new like mixer, a blender, right? Like you have to sit there for like a few minutes reading the thing. Maybe you'll watch a YouTube video, like how do you put this thing together? And that's like for young and competent people all the time, you know. So this like, it's hard. It's not an easy thing. It's not just put it on like a pair of glasses. It's totally different than that. There's a learning curve for how to get comfortable with it, and also how to be convinced that you should actually give it a chance, because also not like glasses, so you put them on, take them off, you put them on and you're like, yeah, now you can see better. It's not like that. Like the first few days are kind of uncomfortable and everything's a little too loud, or what, like sounds are tinny or sharp or like boomy. Like it takes time to get used to it.
Mm-hmm.
So the more you wear it, you'll get used to it easier, but that's like a 3-day sort of learning curve. And if you're like, forget it, I'm not wearing these, take them out, then right. So you want someone there who's going to support you, who is going to be considerate throughout the process. And like, you know, that's the people who you're communicating with need to know that your communication ability and parameters have changed.
Mm-hmm.
Usually the people who notice the difference the most in the first week or two are the other people, the aide, the spouse, the children, because they're saying, I don't have to yell all the time. But the person with the hearing aid is like, nothing has changed. They don't necessarily notice that, because they heard before people were yelling, and they hear now they're not yelling, but they don't know.
Yeah.
So yes, it's very important to have someone with you. And I would also add to that list that there's also the big financial consideration, that when there is so much money on the table, and you're talking about thousands of dollars, several $1,000s sometimes, that's a big investment, and you don't want anybody to be taken advantage of. You want to make sure that decisions are made properly. So that's important. And you want to have a good relationship with your audiologist, because many times the clinicians would be in touch with third party, right? Not with the patient themselves, with the family members, like for repairs or things like that. So you really get to know the whole family and who's involved in their care. So that's a big point. Everyone should be involved, not like buying a pair of shoes, you know. Okay, so what else? I would say that try to make appointments at like the best time of day for the patient. Some people are great in the mornings, and that's like their best hours. Some people take time to get ready, and like after lunch is their you know, peak comfort of doing things and being out. So not when people are tired, not when their medication is like acting up, whatever, what time of day is best, what day of the week, like try to be cognizant of that. Because again, it's not like going in to get a shot and then you could leave and it like doesn't matter. You need to be present. What else? I would say that one of the best things we can do for the people that we love is to let them make decisions also, let them be part of the decision. And that's like one of the things we would see a lot would be kind of a family counseling situation where I'm just trying to tell you about a hearing aid and now I'm involved in like 7 other conversations. So, there's some people are very hesitant. They're very against it. I don't need this. They're kind of in denial perhaps about that they're getting older. We see some of that. So as much as possible to involve the person and get their input, the actual patient who's going to use these and who doesn't believe they need them, maybe, to get them involved and like show them that there's a difference being made with the hearing aids. Sometimes we had, for people who are able, if they wanted, we could do a 2-week trial with a hearing aid. And actually, I think most states also have laws that there's a trial period that's mandated by the law. So if there's any issues or they don't like it or they don't want it, then they have, a month or a month and a half to return them for, a significant refund. So there's a lot of things put in place to protect the patient and protect the consumer, but you gotta go in willing and look at the patient at the center. I say that all the time. I work with kids, so that's like one of the lines we have all the time is that the child is at the center, even though the parents think they know everything and want the best for the child, but they're not the patient. They're not the one who needs all the support. So with elderly, it's sometimes a very similar dynamic. The children or the family, whoever else that's taking care of, think that they know, here's what we're doing, here's what we're buying, and you better use them. Well, that's going to backfire. So that would be my advice. A lot of respect and a lot of communication, because that's what audiology is all about.
Perfect. Dr. Lilach Saperstein, host of the All About Audiology podcast. I appreciate your time tonight. Appreciate all of the information that you've given us. I encourage anyone listening to check out her podcast at allaboutaudiology.com. Thank you for your time this evening, and hope you have a good night.
Thank you. It's been a pleasure.